everybody to this meeting of Commonwealth North's Fiscal Policy Study Group. My name is Juanetta Ayers. I'm the Executive Director for Commonwealth North. And I'll go ahead and turn it over to Cheryl Frasca, our co-chair for the Fiscal Policy Study Group. And Cheryl, take it away.
Yeah, thank you. Thank you, Juanetta. Thank you all for joining us again today, especially after our few meetings this last week and a half. But we're really pleased to have Emily, Ricci, and Kevin Worley talk to us about retirement benefits costs. And if some of you remember who were involved with a previous study that we had done with Commonwealth North with our study group that looked at what was the cost of the healthcare benefit side of the state's budget. And if I recall correctly, we ended up coming up with did I say city? With the state's budget. But it was like a price tag of like 15 million. Well, anyway, it was a lot of money. You can tell I spent a lot of time preparing for this. But Emily got involved, as I remember, back in the reforms that could do some savings to the healthcare benefits side. And it's going to be really interesting to hear about that. And then Kevin's work also telling us about how the systems have become more meeting actuarial expectations, which some of you may recall the large amounts of money that had to be appropriated each year to the retirement system funds. And so this year is significantly less. And so that's the good news, but here's our opportunity to understand why or how. So with that, I'll turn it back to Juanetta to be our moderator, and she'll take it from there. Thanks all for joining us.
Great, thank you, Cheryl. I'm going to bring in both Emily and Kevin, and we'll, I guess I can't spotlight you, Kevin, with your camera off. So I'm not sure who's going to start off, Emily or Kevin. How do you want to do that?
I'll start off. Thank you.
All right.
And I'll go ahead and share my screen now in the presentation if that would be helpful.
Sounds good. Mm-hmm.
Okay. Okay. Can you see my screen now?
Yes.
Okay. Hopefully it's the right screen. It's a presentation, not my email. Okay. So good afternoon, everyone. My name is Emily Ricci, and I'm the Chief Health Administrator in the Division of Retirement and Benefits. That's in the Department of Administration. And I'm here today with Kevin Worley, our Chief Financial Officer. Kevin, do you want to say hi?
Good afternoon.
Okay. And today we're going to talk about the Public Employees Retirement System, or the PERS system, as well as the Teachers Retirement System, or the TERS system. So first of all, I think it's kind of helpful to understand how we're organized, and Kevin's going to talk us through this.
Yes. Good afternoon. This is Kevin Worley. So we look at the administration of the PERS and TERS systems as a subset of all the Alaska retirement systems that we administer. Department of Revenue on the left, particularly the Treasury Division, investments, they do all the investing of the retirement system assets. So they have staff, general consultants, much like Callan, and then they do a lot of internal investing as well as work with external investment managers. On the right-hand side, Department of Administration, Division of Retirement and Benefits, we administer the benefits and the retirement pensions that people earn over their working career. So we have a staff of about 130 people. We consult with Buck Global, and they are our consulting actuary that does all the valuation reports and reports to the Alaska Retirement Management Board. And then we also have third-party administrators, most of which work with Emily on the administration of the medical plans and prescription drug plans. And then we also have external audits and schedules that we provide to all the participating employers of PERS and TERS for inclusion in their audited annual financial reports or annual financial comprehensive reports. And then in the center, the Alaska Retirement Management Board, they do two primary things related to employers, which is setting contribution rates. And then directing the Treasury Division on the investment of the retirement assets via setting asset allocations. A secondary item that is very important that was statutorily given to the retirement board with the creation of the ARM board was a review actuary. As many of you remember, back in late 2000 or late 1990s and early 2000s, there was a situation involved with our actuary at that time, Mercer, where it was discovered that they were undervaluing the health benefits. Since that time and the creation of the ARM board, they have a review actuary that looks at the work that the division's consulting actuary prepares, and then they also report to the ARM board on the adequacy of the valuation reports and the work that was done. So next slide.
Okay, so today when we're talking about the PERS and the TERS system, we're really talking about a couple of different plans. And those plans are kind of embodied in this graph, which really talks about membership and some of the different plans as well as the tier options. So at the top, you have the two columns, PERS and TERS, the public employee retirement system and the TERS retirement system. And then within that, you have two large rows, the defined benefit plan and the defined contribution plans. And the defined benefit plans are those plans that have been available prior to 2006 and offer a defined benefit to members who meet certain eligibility criteria and began employment prior to that time. The defined contribution plans are available to members after 2006 who also meet certain criteria. And they are different plans, but it's also when we think about kind of the membership in terms of what to forecast, what should we expect in terms of healthcare costs to pay out or pension costs that we should pay out or we need to ensure are funded. It's kind of important to understand where our members are within this different chart. So you can see under the PERS column, you have tier 1, tier 2, and tier 3. I'm sure everyone in this group is familiar with the different tiers, but these are essentially, essentially different tiers within that defined benefit plan for public employees who joined the system at different times and have access to different benefits with different vesting opportunities. Tier 1 is kind of the initial, tier 2 was provided later in time, and then tier 3 was really the last tier that was offered to PERS employees before the defined contribution plan was closed in 2006. In TERS, we only have two tiers, tier 1 and tier 2. And then if you look at the defined contribution plans on those rows below, we really refer to those as tier 4 for PERS and tier 3 for TERS. So you may hear people talking about tier 1 versus tier 4. Really what they're referring to is the difference between a defined benefit plan and a defined contribution plan. And you can see, I mean, just looking at the total, we have almost 70,000 defined benefit plan members right now that are either active or retired. And compare that to the defined contribution membership, which only has about 33,000. So the majority of the individuals we're talking about in the system right now at this point in time are in that defined benefit plan. And about 72% of those in the defined benefit plan are actually in a retired status already, which means that they are either eligible to receive benefits at some point or they are already receiving benefits. In the defined contribution plan, in comparison, the majority of members are actively working. And only a small percentage, 157, when this, at this point in time, when this chart was created, are fully retired. So you're really, in the defined contribution plan, we expect that to increase in time. But when we talk about retirement, the retirement trends we're seeing right now, the majority of that is really carried under this defined contribution membership.
And just to, go back a little bit. Yeah, there you go. And many of you may be aware of the Metcalf case, and that was recently settled. But what we're looking at is there's about 2,800 defined contribution members that are impacted by the Metcalf case, meaning that those were prior defined benefit membership who refunded out, did not get back into the DB plan prior to the cutoff of 2010 and had to come into the defined contribution plan. So we're looking at notification of those members as well as what we call former DB members or defined benefit members, folks that may have worked in Tier 1, 2, or 3 for PERS or 1, 2 for TERS, refunded, did not come back into either system by June 30, 2010. That could be impacted. So we're looking at 77,000 people there.
Kevin, they could be impacted by the Metcalf case, correct?
Yep.
Yep. And the extent of that impact is largely unknown at this point.
It is, yeah, it's very much unknown. All right. I was listening in last time when Commissioner Mahoney was giving a presentation, and she had pointed out the significant investment income that the retirement systems had. And as you see on the right-hand side from our draft information that was presented to the ARM board in December of last year, the actual actuarial rate of return that we have currently in our valuation reports is 7.38%. Based on fair value, we made 30% on both the PERS and the TERS systems, just the defined benefit plans. And as you recall, or maybe you've read through the valuation reports or some of the other reports that we provide, we do a 5-year smoothing on the assets to limit volatility on the asset returns. And based on what we're seeing for 2021, that smooth value of assets rate of return is 11.6%, which is still a good 4.22% above actuarial rate of return. So we did phenomenal. It was obviously one of the outlier great years that we've had, and you'll see the results of it on the next coming slides. What that did to the funded level as well as to the value of assets for actuarial value and fair value. And a lot of this started initially with the $3 billion infusion. Cheryl Frasca had mentioned earlier about some of the contributions that we've done to the plan, or the legislature has done to the plan. And $3 billion obviously was the big one back in 2014, 2015 year. So we'll see schedules showing some of the contributions, or the total of contributions that we've received, and what we anticipate those contributions to be going forward. All right, so I believe Commissioner Mahoney had showed this slide at her presentation showing the impacts of the 30% rate of return. And this schedule shows the combined pension and healthcare. And just as a reminder, both PERS and TERS have a pension trust fund and then a healthcare trust fund. And that's what we're showing here on a combined basis. If you look at line D and look at columns for 20 and 21 for both PERS and TERS, you'll see significant jumps, 6.2% jump on our funded ratio for PERS, and about that amount for TERS. Those were fantastic. And prior to that, they've been 1% and 2%. This one was a 6% jump. Based on the fair value of assets on line G, we had tremendous jumps, 20%, from 77.4 to 97.4 for PERS, and we had about a 21% jump on the TERS side. Now remember, this is on a combined basis, so the underlying two trust funds that we're going to be looking at is pensions separate from healthcare. But before we get to those, I know Commissioner Mahoney had pointed out, if you combine what is on line F under the 21 column for PERS of $579 million of underfunding on PERS, combine that with the overfunding of $537 million on TERS, we're about at a net zero. But again, that's on a system-wide for defined benefit plans. So let's look at the breakdown for pension on the next slide. So in regards to the pension system, we're still underfunded. If you look at 2021 for PERS, we're still underfunded by 4.9 billion, almost 5 billion on an actuarial value. But if you look at it on a fair value, we're at about 3.5 billion. On the TERS side, we're underfunded by 1.5 on an actuarial value and 750 million on a fair value. The thing to think about with PERS is, you know, there's a plan in place since we got that $3 billion infusion. The plan in place is to continue chipping away at that unfunded liability and reaching 100% funded level. We're looking at 2039 as being that point where if we continue along the path of funding, meeting the contributions, state contributing additional contribution to make up that difference between the cap 22 rate and then the actuarially determined rate, you know, we can chip away at it. The thing that we don't have with the pension system that we did with, you know, the healthcare, which Emily can talk a little bit about later, Emily and her group have been able to implement some very major cost savings to the healthcare side, which projected us from, you know, looking at 2006 up to 2039 of, hey, we'll get 100% funded by 2039. Well, we've passed that point because of these dramatic plans that Emily and her group got us in that saved money and got us ahead. Anyway, getting back to this pension, the thing that we're focused on is step by step, keep improving, keep meeting those goals, and that's where we are. And then obviously the 30% return last year is very helpful. On the next slide, this is just the healthcare portion. So if you look at all the red numbers on line C and line F, those show you that we're overfunded. So on an actuarial basis that was presented in December for PERS, we're 1.7 billion overfunded on the actuarial value of asset side, but on fair value, we're almost 3 billion over. So we're very overfunded in both PERS and TERS. We're 832 million on an actuarial value and roughly 1.3 billion overfunded. And these are numbers as of June 30, 2021, after that 30% year. We'll be having our next valuation for June 30, 2022. Will begin in September of this year, and we'll see the draft results as of the end of fiscal year 22 in the December ARM board meeting. So we only do these numbers once a year. But this report for 2021 is scheduled to be adopted by the ARM board in June. And then we start the process all over again, and we'll see where we're at with 22 in December of 22.
So I'm going to add.
Next slide.
Oh, okay.
Sorry, go ahead.
Well, I was just going to talk a little bit about how we got here in terms of the funding levels, and we're going to talk more about this in some slides that are coming up. But you know, really, there have been a number of changes in the healthcare landscape. When I first started with the division initially, I've been like back and forth with the division in 2012. At one point, I heard, and this is anecdotal, but I heard that we had one of the highest unfunded liabilities for healthcare per capita out of state governments. Again, take that with a grain of salt because I didn't actually see the numbers, but that was relayed to me. And to go from there to here in 10 years, I think is pretty remarkable. And it really demonstrates the work of a lot of different teams. I think the investment team has done a fantastic job leveraging the experience of the market over the last couple of years. I know the health team, with support from multiple commissioners and administrations, has really tried to help focus on ways that we can identify savings in the retiree plan. And for members of this group who are not aware, making any changes to the retiree health plan can be very, very challenging because we have some pretty strict constitutional requirements we have to meet, and we are generally facing litigation when changes are implemented. But we have been able over the last few years to identify ways to save money through either better leveraging our contractual agreement so that we get better pricing for our services, to implementing some new prescription drug programs that have resulted in additional federal subsidies and drug manufacturer rebates to the plan. I think year one we implemented it and we saw about $49 million worth of savings. And this year we're expecting, in 2021, we're expecting $64 million worth of savings. And so to achieve savings like that in a program where members are not seeing a reduction in their benefits or a change in their benefits is something very special and unique. And it's taken a lot of work. And one of the things that I kind of think about is sometimes when you make large changes in state government that result in cost savings, in the tens of millions of dollars, and you don't hear about it, in some ways that's actually success, because people aren't coming and beating down your door saying you took all these things away from me. But again, we focus very, very hard on the health plan side and in finding those areas where we can identify win-wins, where we're implementing savings to the plan in a way that doesn't impact member benefits. And I think that, combined with some of the investment results, have resulted in the funded status that you see with the health plans today. And we're very proud of it. So Kevin, I'll move on to the next slide now.
Why don't you stay right there for a second? So one thing that we typically get asked is, where do we stand compared to other pension and healthcare plans? And usually we look to NASRA, because NASRA does a survey of roughly 130 retirement plans. They do not look at healthcare funding at this point because the comparisons are very difficult to do. So we don't have any stats for the healthcare side, but when you think about Alaska pre-funding both pension or both PERS and TERS, there was a lot of good forethought in that. So just the fact that we've funded it and now we've overfunded this as a result of the cost savings that were implemented, as well as this last year of rate of return, been fantastic. Looking at the pension side, the last data that was released was through June 30 of 2020. And just by looking at funded ratio out of the 120 members that they polled for the teachers retirement system in terms of funded ratio, we ranked 54th, and for PERS we were ranked 89th. So just so you know where we stand. And that probably hasn't changed a whole lot because a lot of plans did a lot of good investing in rate of return last year. All right. Next slide. And this is just a picture graph, bar graph of where our funded level has changed from 2001. Again, we were indicating it, earlier about the Mercer situation. Also, the dot-com crash was about that time. So you see the impact of re-looking at all that information and what that had on taking us from over 90 and 100% down into the 70s and dropping down. Then we had, the crash in 2007, 2008, and the impacts that it did there. But you see, we've done a nice steady climb. We were very level from about 2015 through 2020, and then we made a nice jump up as a result of this past fiscal year. Next slide. And the next slide just shows you where we stand compared to other years in terms of our combined unfunded actuarial liability. So we're at the lowest point we've been in since 2008. Okay.
So this slide talks about some of the additional state contributions, which again, I'm sure this group is familiar with, but these are contributions that the state is making kind of above and beyond the normal employer contributions for both the PERS and TERS system. And you can see the state assistance payment or the state contributions are highly variable, and they reflect, a number of different actuarial factors. But I always want to point out the addition of $3 billion that was made to the PERS and TERS systems in 2015, and the effect that had on the state contributions that were really increasing to, over $600 million a year. That large contribution has helped reduce those state contributions ranging from between as low as 184 million to 340 over the last 8 or so years. Kevin, is there anything you want to add on this slide?
No, ma'am.
Okay.
Very good. So, Carol Frasco was talking a little bit about the impacts of this past year and what that has on our additional state contribution, and this is the result of it. We're seeing a decrease, obviously, because of that 30% rate of return, but the other decrease is related to Senate Bill 55 that was passed last year, which made the state of Alaska paying the full actuarial rate that was determined by the actuaries. And previously, the state was also capped at 22%, and that money would have been included in this additional state contribution amount. The impact of Senate Bill 55 and having the state as an employer paying the full rate was discussed numerous times by Office of Management and Budget in different meetings that would allow the state as an employer, if they're charging federal programs or other grants or other funding sources, the full actuarial rate as opposed to being capped at 22%. And so there was some general fund money that was undesignated general fund money that was saved that way. So that initially reduced the PERS contribution on this schedule. And then obviously the 30% rate of return. The other impact on this schedule, though, was in October of last year, the ARM board, when setting the FY23 contribution rates, there was a recognition that we are so overfunded on the healthcare trust that it didn't make financial sense to contribute more money to a plan that was already overfunded and would continue to be overfunded and, in fact, increase in its overfunded status. So the ARM board adopted a zero normal cost contribution and for FY23. So no money is going to the healthcare trust in terms of contributions, but obviously the earnings will continue to stay in that plan. What it did do, though, was shift the money that was in the 22%. So previously, that 22% rate, or the 22% contribution rate that's capped by statute, prior to this adoption of zero normal cost for healthcare, we would split that 22%. Some would go to the healthcare trust, the remainder would go to the pension trust. Based on that adoption of zero normal cost for the PERS and TERS plans, for PERS, the entire 22% for a DB member is going to go into the pension trust. And the same thing will occur for the teacher's retirement system. A DB member, the employer match of 12.56 will all go to the pension trust, and that'll continue to bolster that slow grind up to 100% by 2039. And then the impact on that is the additional state contribution that you see here was less than what was actually projected in the latest valuation report. So there was some cost savings on the PERS side for this and for the TERS side. Okay. On this next slide, just to further hammer home why a 0% normal cost was adopted for PERS and TERS healthcare, we have a schedule of your funded levels with the normal cost contribution and without the normal cost contribution for both PERS and TERS. And if you look at the column heading without normal cost contributed, as projected by our consulting actuary Buck, you'll see that the lowest, based on projections that it would dip, would be the 108.7 for PERS, and it would be over 118% for TERS. So with that in mind, the ARM board took a one-year look at, let's see how this works, because it looks like we can do that. And both our actuary and then the review actuary agreed that we could do that for 23. One question that did come to mind, one of the board members had asked was, just on a fair value, what would it take for investment losses in 2022 to bring that fair value of assets down to the actual level of the liability so that we were back at 100% funded? And for that to occur, PERS would have to lose about 20% for the fiscal year, and TERS would have to lose just over 25%. But again, that's on a fair value. But I think overall, the thing to keep in mind is, while the board did choose to adopt a zero contribution rate to the healthcare trust, keeping in mind that overfunding, and then also looking at these projections, that we wouldn't even hit below 100% at that point. All right, thank you.
Okay. So slide 13 talks about healthcare cost trend rates, and these rates are determined by Buck. And you'll notice there's really three different trends that they're evaluating when they consider, what the potential liabilities are for the health plan. The first is medical for those who are pre-65, so those who are not Medicare eligible. Those trends tend to be higher initially than trends for members who are Medicare age eligible. And part of that has to do with when a member becomes Medicare age eligible, the Alaska Care Plan is actually in a secondary payer position. So we're paying after Medicare. In addition, Medicare establishes a fee schedule, and that fee schedule is substantially lower than most commercial rates. So that combination of a flat fee schedule and the Alaska Care Plan being in a secondary position means that the plan pays significantly less for members once they become Medicare age eligible. And that's also another important contributor to some of the improved experience that we're seeing in the health plans, is that members are aging into Medicare at a fairly rapid pace now. And then the last set of columns for cost trend that you're seeing has to do with prescription drugs and a funny acronym called EGWIP that we're going to talk about in a couple of slides. But some of the questions that we get, or that I know I pose back to Buck, is, these rates seem sometimes lower than what we actually experience in the plan, and they tend to drop over time. So why is that happening? And one of the kind of actuarial assumptions that I think is pretty standard is that as I'm sure this group is well aware, the cost of healthcare growth, or the overall trend in healthcare, has outpaced the relative increase in GDP for many years now. At some point that has to change. Healthcare cannot continue to outpace GDP in perpetuity. And so when they're looking at years, 2040, 2045, 2050, they're assuming that there will be a stabilizing impact. Okay, so the next slide starts to really reference, what we've been talking about earlier in terms of some of the changes we made to the prescription drug program. So in 2019, we implemented a Medicare Part D group employer group waiver plan, or EGWIP. For some reason, that acronym makes me think of like a slug or something like that. But EGWIP has been highly, highly important to the plan's financial experience. As I said in a previous slide, proportionally more of our members are becoming Medicare eligible. And so what this means is, when you look at the amount of dollars that the plan pays out, the plan on the retiree side is paying out a disproportionately high percentage of its dollars towards prescription drugs, because prior to the implementation of this employer group waiver plan, the retiree plan was a primary payer for prescription drugs, whereas we were in the secondary position for medical costs when members became Medicare age eligible. So prior to 2019, the retiree health plan was engaging in some federal, essentially, subsidies that were available to offset the cost of prescription drug for retirees through a program called the Retiree Drug Subsidy Program, or RDS. The plan had been using RDS for a very long time. However, RDS was not as financially favorable as this additional program called the Employer Group Waiver Program, which is actually a group Medicare Part D plan. So if you are a Medicare member in the individual market and you're not covered under our Alaska Care Retiree Plan, you would not be able to participate in the specific Medicare Part D plan. The group Medicare Part D plan is almost like a Medicare Part D plan specific to our Alaska Care retirees. And establishing this group Medicare Part D plan allows the plan to access additional federal subsidies as well as drug manufacturer rebates. And the amount of those additional subsidies and rebates is tremendous. With RDS, we were seeing around $19–20 million a year in additional rebates to the plan. Effective 2019, when we implemented AGWIP, we're seeing $30 million more than that. So we're seeing $50 million a year in these subsidies and rebates coming back to the plan. That amount increases over time, partly because cost of it reflects the cost of prescription drugs, which is increasing astronomically. But those rebates and subsidies have increased every year. So they started in 2019 at 49 million, and they've now increased to 64 million in 2021. So this is really an important source of funds to offset the cost of prescription drugs for our retiree members. And it's something that we monitor closely. There's 5 different types of ways that the plan can receive these federal subsidies or drug manufacturer rebates. I'm not going to spend a lot of time talking through all of them, but the 2 big ones are the catastrophic reinsurance, where a portion of the cost of the medication is actually picked up by the federal government. So once a member reaches an amount that's determined on an annual basis, I think this year it's more than like $6,500 in terms of their drug spend, the federal government picks up a substantial portion of the cost for their future drug use, which is really important for members who are using things like specialty medications, where a single prescription can cost as much as $100,000. Not a single prescription, but a course of treatment over the year can cost like $100,000. So that's a substantial amount of money that is now being picked up through this catastrophic reinsurance channel. The other big channel is a coverage gap discount. And this actually is where drug manufacturers provide an 80% discount, or essentially rebate, for medications filled when members are in something called the donut hole, or this this financial bookends, I guess you could say, annually. So all of these different forms of channels of federal funds and drug manufacturer rebates flow back to the plan. What we were able to do, and what made this so complicated, was we have actually set up the plan in a way where, despite all of these funds coming into the plan, the members don't experience anything differently in 2019 than they did in 2018 in terms of going to the pharmacy, handing over a card, and getting the same $4, $8, or in some cases $0 copay for their medications. And that's really important, because I don't think we would be able to leverage these federal subsidies if members weren't able to have the same plan experience. So again, this is something we watch very carefully. Occasionally, you'll probably hear about, federal review of Medicare Part D and some of the subsidies associated with that. We are like razor focused on what that is, because we want to make sure that any of those changes, don't impact the savings that we're seeing in our retiree plan. Kevin, I think we're back to you. Oh, Kevin seems to have dropped off. Can you guys hear me?
Yeah, we can hear you.
Okay.
Yeah.
Well, I'm going to try to step in for Kevin. I'm not the Chief Financial Officer, so when he comes back on, he might have to repeat some of this. But on slide 15, you can see the historical rate of return as well as the funded ratios. And again, you'll note, especially in the early 2000s, you were seeing some lower rates of return and lower funded ratios. I'm seeing that again in 2010 and 2009. And then, of course, seeing the improvement, particularly in the last 2 years when it comes to these funded ratios, as well as rates of return.
He's back online, but now he dropped off again. Oh, there he is. Okay.
Kevin, are you there?
Can you hear me?
Yeah.
Yeah,
Well, I did a brief
I don't-
overview of this slide, slide 15. You're welcome to add anything to it, or we can move on to the next one.
If you've discussed it and nothing's, we could save questions. But the big thing is we're at 8.33 and 8.37 for 30-year rate of return. We do have an actuarial experience study that's currently going on that will be used for the FY22 valuation report. And what was presented to the ARM board, just so everybody is aware, is a reduction from 7.38%, which we're seeing on 2019, 20, and 21, dropping that from 7.38 down to 7%. That hasn't been adopted yet. That was presented as part of the experience study. We're looking at these assumptions being adopted by June of this year, so in a few months. That's where we're at. So that's all I wanted to point out there. So just to follow up on that discussion, this is the timelines that we use on evaluation reports and experience studies, and it's quite a chart to look at. But if anybody has particular questions related to it, we can discuss it later. It's just to show you that we do have an experience study popping up. If you see in that green box, 22 valuation, that's what we're currently reviewing. So we're expecting the June 30, 21 valuation report to be adopted in June of this year. And then we start the experience study assumptions adoption also around that same time frame. So moving forward, we'll see changes in a few of the 30+ assumptions that we use in the valuation reports. And the bigger ones are the rate of return, and then some of the health items. Inflation is going to be another one that's a key item that's being discussed. So that is on the horizon.
Okay. So this next slide is, just some basic information. It really talks about some of the FY 2023 contribution rates for the defined benefit plans. And some of these are actuarially determined, while other rates are capped by statute. So in 2023, the combined rates for PERS range from 6.75% to 9.6%, depending on the type of employee that the rates are established for. And then for the TERS system, it's 8.65%. The employer rates are capped by Alaska statute at 22% for PERS and 12.5% for PERS. The total required contributions for the fiscal year, so what the actuaries determine is necessary to essentially adequately fund the plans, is 24%, 24.79% for PERS and 24.62% for TERS. So the additional state contribution for non-state employers is really the difference between the 22% employer rate for PERS and that 24.79% and that 12.56% for TERS and the 24.62% for TERS. So when we're talking about those additional state contribution rates, those are established based on kind of this center line here, and really the difference between the statutory caps and then the amounts the actuaries determine are necessary for adequate funding. So it's that combination of 12.6%, 12.06%, and 2.79%. Kevin, do you want to add anything?
Nope. Good.
Did I hear a question?
Yeah, hi, this is Cheryl. Who are these non-state employers?
So the non-state employers, this is a little bit of a result of the of what Kevin was talking about. Is it SB 55 last year that passed? So the state is paying the full 24.79% for all of its employees, instead of that 22% with the 2.79% being picked up by the state assistance payment, but all the other political subdivisions. So, any of the other municipalities or boroughs or other groups that are participating in the PERS program are only paying that 22%. And then the state assistance payment is picking up that 2.79%. Does that make sense?
Sort of, but one of the things I recall from, past life when I worked on this stuff, but they're included in the PERS system were non-state entities, like if I recall correctly, Bartlett Hospital, housing authorities,
Mhm.
Alaska Municipal League. And
Right.
so I always wondered, why are they in there? And are they benefiting from the additional contributions that the state is making?
You know, as to why they're, oh, go ahead, Kevin.
Oh, I was just going to say, one, Alaska Municipal League isn't in PERS any longer.
Okay,
And Bartlett is in because they're part of the city and borough of Juneau.
Yep.
So they're under that umbrella. So they're in PERS.
They're borough employees,
housing-
essentially.
Yeah.
Hmm.
Yep.
Oh,
So, 'cause we've had other hospitals that were in PERS because they were under the city and or borough umbrella.
gotcha. And housing authorities?
I'd have to look at the housing authorities and get back to the group.
Okay, yeah, I just was curious and saw this as an opportunity to ask. So,
Yeah,
Thank you.
I assume part of it's the statutory definition and just how they fit under that definition.
yeah. And we know how those
So we,
statutory are made. Anyway, keep going, sorry.
That's great. Good question. Thank you.
Okay, so the next slide talks about the defined contribution, the rates for the defined contribution plan. And again, some of these are established in statute. Others are not, but others are actuarially determined. But the employee rates for PERS and TERS are 8%. The employer rates for the investment account and healthcare vary. It seems like they're higher in TERS and a little bit lower in PERS. Occupational death and disability as well are variable. And then the health reimbursement account is an account that individuals can access after working in PERS for 10 years. Well, they invest in that, and then they can use it to pay for some of their medical costs once they reach age 65, and that is a flat dollar rate that is 3% of all PERS and TERS average annual compensation. And then any sort of excess between the necessary contribution rates under the defined contribution plan and the 22% or the 12.56%, which is that employer, that statutorily required employer cap, any difference between those two actually goes to pay the defined benefit unfunded liability. Kevin, did you want to add anything?
Nope, you got it covered.
Okay.
This slide is just showing you a pictograph of what the contribution rates have been since 2008. Obviously, this past year is going to be low because of the zero contribution rate for the healthcare trust. It would have been a little bit higher. It would have been 27.34% for PERS, and then for wrong one. Here's my picture. Sorry, I grabbed the wrong slide. 27.63 for PERS and 27.34 for TERS. With the adoption of a 0% for normal costs, that did put these a little bit lower than what was originally proposed, but again, because the healthcare trusts are so overfunded, it made sense at that time. That's it on that one.
So this last slide is really the projections for pension benefit recipients, and we're always thinking, at least I think I'm always thinking a little bit near term in terms of kind of these peaks that you can see occurring in 2029. But I think it's important to note that we will have obligations to beneficiaries, including survivors, for decades to come. I remember last year, I read an article about how the last beneficiary of the Civil War pension passed away last year. So I don't think we're necessarily going to experience that with our pension plans, but it's always important to remember that this is really, decades decades out, if not longer, in terms of the obligations that we have to our beneficiaries and to their survivors as well.
And this just shows what Emily was just talking about on the Civil War beneficiary. Projections show that we'll at least have one beneficiary around the 2100 mark. That just shows you how long that tail of payments is. So while we peak at around 2029, 2030 in terms of the number of retirees, you'll see that we actually have a peak for our payment stream about 2036, 37 in total, and then for PERS. And then obviously that scales out as we go further into the century. But that's what is currently projected by our actuary. And this is just the pension side. It doesn't show the healthcare piece. And that is it for our presentation. So we're, I believe, open for questions. Is that right, Juanita?
Yes, thank you. So for the audience, we will, go ahead, Emily, if you want to stop share.
Just trying to figure out how to do that.
Oh, here I go. I'm sorry.
Okay.
I was looking in the wrong place.
Thanks.
All right. Well, for our audience, we will take your questions because we're a bit more of a manageable size group today. We'll go ahead and have folks either raise your hand and I can call on you to open your mic and ask your question. You can submit it in the chat if you'd prefer that we do it that way, and you can turn on your camera and ask a question as well. But I'll go back to Cheryl to see if she has any additional questions to start with. Cheryl?
Oh, thanks, Juanita. No, let's see if the group has any.
Okay.
Sure.
I'll just start out with one. The last two charts that you were showing with those curves with the long tails, that's for the eligible population at this point in time. It's not taking into account the changing population. Would that be a correct interpretation of that chart?
This takes into account the number of folks that are currently retired and then could be retiring over the next few years, yes.
Right.
This does not take into consideration folks that are in via the Metcalf decision.
Mhm.
That has not been put in any of this data at this point, because while we reached or heard back from the case last September, October, I believe, it was remanded back to the Superior Court that they needed to provide some direction to the division about a number of things. We only recently heard back from the Superior Court, I believe at the start of this month.
Mhm.
So that's where we have 4 months to notify impacted membership. So that's where that 2,300 number for current DC members that were prior DB members, and the roughly 70,000 other folks that could be impacted. We do not know what that impact yet is.
And with regard, thank you, Kevin. And with regard to the experience study, it's my understanding is that maybe you're looking at some of the draft from that study at this point and expect a public report in June. Is that correct?
Excuse me. So in December, we looked at economic factors, inflation being one, and then the actuarial rate of return, which is currently 7.38. The proposal at that meeting is 7. And after that presentation, the actuarial committee had asked for the dollar impact of these things. So they want to look at the dollar impact of changing inflation from our current 2.5 down to 2.25. They had Bucket actually recommended roughly 2%, and granted during our current time, 2% seems pretty low to when we're looking at 7, 8, 9% inflation, over the last few months. But that was presented in December, and what we're going to be looking at is demographic assumption change proposals next month. So Buck is in the process of getting their presentation for March, which will also be discussed by GRS, or Gabriel Roeder Smith, who is the ARM board's review actuary. So they'll be also looking at that information, and as well as offering proposals which may differ from Buck.
So in total, with the experience study, what you'll have is a refinement of both the economic assumptions as well as the demographic assumptions that are part of future projections for both systems.
Yes, ma'am.
Okay. And Cheryl, you had a question?
Well, I just wanted to follow up and just tell Emily, as a retiree who went through the changes, the prescription program, you're absolutely right. It really was seamless. So thank you for doing a good job and doing it easily, which we don't often get to say in government. And you may have, Kevin, you may have answered this, but since the health side is so overfunded, is there not a reason you can't take some of that overfunding and move it over to the retirement side?
I did not talk about that, but we've been asked about that quite frequently. The issue that we have is that the trust funds, the way the statutes are set up, is that these are exclusive benefit trust funds. And so the money that is within that trust fund is for the exclusive benefit of those members for that particular benefit. So we are not able to take any overfunding from the healthcare trust and move it over to the pension trust.
Without a statute. Yeah.
Yeah, it's exclusive benefit. And then I know we talk about diminishment of benefits.
Yeah.
So while one might say, well, your health benefit isn't going to be diminished any by us moving money from the overfunded health to the underfunded pension, but if you do have that minus 25 year, then all of a sudden you shift money over, and then all of a sudden you have this underfunding. Would you consider that a diminishment of your benefit?
Right.
Maybe not. You
Yeah.
still see, you're still seeing the system paying that, but we've talked to legal counsel about that particular issue, and it is a no-no. So money that's within the plan stays in the plan or stays within that trust. Because one of the questions that was brought up last October, for example, was the ARM board was wrestling with well, what if we adopt this normal cost for the healthcare trust and then direct the division to take that money and instead put it into the pension trust? And the ARM board's legal counsel said that is not allowed.
Mm-hmm. Yeah. Okay.
So
Got
you
Okay,
can't
thank you.
adopt a rate going to one trust and then diverting it to another trust. So in that case, when they adopted zero, all the money is still going to the pension trust that should be going to the pension trust. Just no money is necessary in that healthcare trust for this year, and we'll see how that pans out. And the board will look at it again. Yeah.
Okay. Thank you.
Yep.
We are
long-winded.
No, that's great. Thank you, Kevin and Cheryl. We are coming up. We're just after 1 o'clock, and our audience is being uncharacteristically quiet. So I guess Emily and Kevin, you've answered everyone's questions. Yes, go ahead, Brian.
Darn it.
Yeah, first of all, I want to say hello to my friend Kevin. It's been a long time.
It has been, Brian. I saw your name on there. Yeah.
Yeah, I appreciate
Nice to hear from you.
Yeah, you too. Appreciate you coming in and talking about this today. I want to revisit real quickly. I know we're past time here, Juanetta. I just want to revisit real quick. If I heard something correct here, back in December, the recommendation was to reduce the outlook for long-term inflation. Is that what I'm hearing?
Yes, that was the initial discussion item from Buck, was reducing the long-term assumption for inflation from 2.5 down to 2. That was met with some groans by the trustees. Fallon, I believe, said they were looking at about a 2.25% long-term inflation. So we are looking at that item again next month. So if you're really into the inflation thing, that would be a good meeting to attend, the actuarial committee.
It just seems like we're in a period where, shoot, we've been down this road where we got ourselves in trouble with underfunding. And I'd kind of hate to find ourselves kind of back in that because we undershot. I think I'd rather be a little more conservative, but that's just me. Anyway, it's good to see you, Kevin, or at least hear you.
Good to hear you, sir. Good to hear you, sir. I will recommend to the group that ARM board meetings are held online through Teams. You can listen over the phone. Packets are available, so you can look through the whole thing. There's public comment times that you can call in and discuss for each of the committees as well as the board meetings. So if you have a question or a comment such as what Brian brought up, certainly you can call in and make it, or you could send in an email and share that with the board.
Well, let me close with one final question for both of you, which is if there were a policy consideration or change that you would hope to see either out of this legislative session or in the next year that would most impact the cost or the benefit of the state retirement programs, what would you like to see?
Oh, good question.
I'll let Emily go first on that.
Well, it's dangerous. We have been evaluating, and we're going to continue to evaluate, looking at establishing a Medicare Advantage plan as an option for retirees. We've talked about it conceptually. We have a long ways to go before we know if it is viable or feasible for a variety of different reasons, some of which are legal. I'm optimistic that we are about to kind of have a new chapter in our relationship with retirees and be able to make some announcements in the next couple of weeks about that. And I think if that's true and we can work together collaboratively, a Medicare Advantage plan, I think, could provide it could be another win-win for the state, where we're able to see some reduced costs, improved benefits for our retiree members, and perhaps some improved access to primary care for members who are Medicare age eligible, because that's something that we know is really tough. So that's going to be one of the items that we're evaluating very seriously, probably for the next year to 2 years on our end.
Great, thanks. And Kevin?
If you watched the Senate Finance Committee last week, the Senate Finance Committee had asked us to come forward with what would the impacts of a $250 million or $500 million infusion into the pension trust funds, what that impact would be. That would be my biggest thing. I mean, you saw the results of that $3 billion. The impact of 250 or 500 could get us to a point where we're done with these capped rates of 22% and 12.56. That would be my big request.
Great. Well, thank you both for your information and insights into this most important aspect of our state's financial obligations. And like Cheryl, I'm a retiree beneficiary, Tier 1, so I'm paying attention to these issues and appreciate the information that you shared today. Just for the listening audience, we do have a couple of pending invitations, but no confirmed sessions to announce. But hopefully check your email at the end of next week. Hopefully we'll have future sessions information for you in a monthly email at the end of next week. And Cheryl, any closing comments that you'd like to add?
No, just thank you all who've joined us today, and thank you, Kevin, and thank you, Emily, for a very informative discussion. We really appreciate it.
Yeah,
Thank you very much for the invite. Had a good time.
Great, thank you. You know, I will say one observation is that the slide about the supplemental contributions. I worked in the Parnell administration, and I can remember how controversial that supplemental contribution was. But to see the fiscal impact moving forward from that is, I think, unquestionably the right move at the right time. So I particularly appreciated that perspective and look back at that very controversial decision at the time. All right, folks, have a great Thursday, and we'll hopefully see you again in a week or two. Thanks.
Thank you.